Mate, Alex, we're talking about the ITB, the iliotibial bands, that pain on the side of your knee. It can be quite sharp when you're a runner. Tell us, what is it and how do we go about fixing it?
I think it's definitely, runners who have had this know that they've got it. It's one of those pains that doesn't, like front of knee pain, runner's knee, might come on, it's not as sharp, you can run through it. IT band is going to be in that pain right on the outside of your knee. When it comes on severely, you'll know about it. It's like someone sticking a screwdriver in your knee. What it is, we used to think it was friction, but now we probably know that it's not. It's probably more likely compression. And there's some pain-sensitive structures underneath the IT band as it crosses your knee joint there, or just above your knee joint. There's a fat pad that just sits under there, and that's highly innervated with nerves. And when it gets pissed off, it gets really irritated. And so just above the knee joint in this area. So a big one, Paddy, is training load. If your training load's gone up significantly, it can make you more prone to getting IT band issues. Yeah. A running technique plays a massive role, and there's a couple of things that we look for that we see commonly. One of them is crossover. Do you land like running on a tightrope when your feet are going left, right? Are you running on a tightrope? Do you have some weakness in the hip potentially and have what we call a hip drop, or does your knee fall in? They're really big ones. What we want to start doing is addressing strength around the glute, strength around the quad, and settle those symptoms down initially. It's not one of those conditions you can continue to run through. So settle training load. In fact, sometimes you really have to deload and actually completely rest for a few days. It's one of those conditions that does need time just to settle. And then we start ramping things up. So they're the big ones. Get your running technique looked at, reduce your training load, start strengthening around the glutes and the quad, and start to maybe even lengthen some of those tissues around the quad, hip flex up.
And it's often not a footwear fix as well. There's usually quite a biomechanical cause that's going through your leg. Anything that's causing your knee to go across the midline when you're running.
We'll put more compression.
Technique and strength around your hip is just crucial for that. It's an annoying injury, but if you let it settle initially and address all the biomechanical factors around it, that's how you've got to approach this one.
One of those ones you do something about early. If you hit it early, you can usually get it under control.